I am joined tonight by four amazing women from the Davidson class of 2011. Again, we have Katie Laycock, Sarah Little Marucci, Meredith Ashu Stouch, and Louisa Wall Whitesides. I'm going to ask each of them to take a few moments to introduce themselves, including their role in healthcare. After their introductions, we'll dig into some questions. Following that, we'll open the floor for some Q&A, and then we will close our call for the evening. I'm going to ask Katie to kick us off, followed by Sarah, Meredith, and Louisa. So Katie, over to you.
All right, thanks, Judith. Well, I'm Katie Laycock. I was a studio art major when I was in at Davidson and involved in the symphony orchestra and some other kind of arts organizations during my time there. And now I'm in Indianapolis and took a bit of a windy route there. I went home to South Alabama for med school first, and then did residency in pediatrics in New Orleans at Tulane, and additional training in pediatric infectious diseases in fellowship in Philadelphia. But now I'm in Indianapolis in academic medicine and wear a few different hats besides just seeing patients. I'm involved in education for our trainees and infection prevention and do some research as well.
Awesome. Good evening, everybody. I'm Sarah Marucci, Sarah Little Marucci, and I am really excited to be here tonight. So thank you all for joining. But after graduation from Davidson, I went to medical school at UT Southwestern. I guess I should talk about my Davidson experience a little bit. Sorry about that, Judith. But at Davidson, I was involved in a lot of kind of different random things, but loved playing sports. We did lots of intramurals and club soccer and the Davidson Outdoors. I don't remember the name of that email that we would get every day, but I loved just going to everything on that email that came out. All the different speakers and talks and activities, and also was a member of Turner House and volunteered at Ada Jenkins. I don't even know if that's still around, but did lots of different things. Loved my Davidson experience, but kind of always knew that I was going to be a doctor. It was kind of just a calling I had. Both my parents were physicians, and I could never really see myself as anything else. And so went right into medical school at UT Southwestern in Dallas. And that's where I met my husband. He was in my class, and then we couples matched for residency. I did internal medicine. He was anesthesia. We ended up at residency in University of Alabama in Birmingham. And then at Birmingham, I couldn't really decide for a while what I wanted to do. Did I want to do just general internal medicine? I loved staying broad, kind of that liberal arts Davidson education, staying broad. But kind of later on in my 3 years of residency, I realized that I wanted to specialize and could just see that better for my life moving forward. And so I decided to go into GI. And my husband had another year of residency. So I spent a year just enjoying general internal medicine for a while as a hospitalist. Also got my master's of public health at that time. And then we ended up in Houston, where I did my fellowship in gastroenterology at Baylor College of Medicine. And then from there, I had one son, my third year of residency. And then, so kind of balancing life and fellowship was crazy, and COVID and all that sort of thing. And so after finishing training, I know I wanted to stay in Texas because that's where both my husband and I are from and our families are here. But I knew I wanted to stay in academics. So I kind of interviewed at all the academic places in Texas, and we just kind of felt at home in San Antonio. So we don't really have true connection to San Antonio, but we both found jobs that we loved. And so I'm currently on faculty at UT Health in San Antonio in gastroenterology. And I'm also really involved in the fellowship education as one of the program directors.
Wonderful. Good evening, everyone. I'm Meredith Ashley Stouch. At Davidson, I was a psychology major with a concentration in medical ethics. I was also in the symphony. I played the cello. I was a tour guide, a member of Connor House, a lifeguard at the Lake campus. And most relevantly, I worked as a sideline EMT for football, rugby, and men's lacrosse. And it was that experience that, sort of ignited my passion for emergency medicine. We had a incident on the rugby pitch where two players collided head on in a scrum. And somehow the two front teeth of one player ended up in the skull of another player. So both were promptly taken by ambulance. And I said, wow, I wonder what the ER is going to do with that. So fast forward a few years. After Davidson, I earned my master's from Emory University. I'm double boarded as a family and emergency nurse practitioner. And for the past 11 years, I've worked in the Level 1 Trauma Center at Grady Memorial Hospital in downtown Atlanta. I was told during my Grady orientation that we see it all and we do it all, and that has proven to be very true. My days are really exciting. They're tragic, but also exciting, and we get to save a lot of lives too. And I tell people if you've ever seen the HBO Max show, The Pit, that's essentially a day in my life. So along the way, while working at the bedside, I also had the opportunity to move into leadership. So nurse practitioners are one type of what we call advanced practice providers, or APPs, a group that also includes physician assistants, nurse midwives, and nurse anesthetists, or CRNAs. So for many years, I served as the chief APP for emergency medicine, including throughout COVID, which was a whole different topic. But I'm now the inaugural director of APPs for Emory at Grady. So I help oversee about 200 APPs across all the specialties in our health system. So still in Atlanta. I did meet my husband here, and we have two boys as well. I think there's a few boy moms on the call.
Thanks, Meredith. Hi, I'm Louisa Whitesides, or Louisa Wall Whitesides. I see a few other Whitesides on this call, so hi. Um, let's see. I was a classics major at Davidson. I knew I wanted to go into medicine, but didn't want to take, the traditional route. I had a lot of different interests and ended up going on the classic semester abroad my sophomore year. And that was an amazing trip. I started to think a little bit more about like what it means to be a physician and ended up writing my thesis on end of life care in ancient Greece and the Hippocratic doctors and how they approached that. While at Davidson, I was also interested in, I was a part of the Davidson Reader, which I don't think exists anymore, but it was a magazine.
Mhm.
Um, and then I was a part of Warner as well. When I graduated, I took a year in between medical school and college and medical school, and I did research in Atlanta at Emory in ethics and worked with the care team there. Then I went on to medical school at Emory. So we have that connection, Meredith. Was there for 4 years with my now husband, Boyce, who is also a Davidson grad in our class. And then we matched. Well, I matched. He went to business school, but we went to Philadelphia and spent 3 years there. I did internal medicine residency. Um, I was throughout my whole time, I was interested in palliative care and ethics, and was thinking in residency I wanted to do some sort of like complex disease. And I remember walking through the CCU my second year and just seeing a lot of patients who really could use a lot of help with physical therapy and movement, and realized that function was incredibly important in medicine and something that we don't spend enough time doing. So I decided to do a geriatrics fellowship. And so I did a 1 year geriatrics fellowship at GW. At the time, Boyce was working in DC, and was on faculty at GW for 5 years in the geriatrics division there, and recently went into private practice in October where I practice geriatrics. And we have 3 boys too. So
Lots of, as was said, lots of boy moms on the call.
yeah.
Amazing. Well, thank you all for sharing your stories already. I'm excited to hear what we're still about to delve into, but so exciting to hear all the amazing things you all have done and undoubtedly will still continue to do in your careers. Thanks for each of you for sharing how you got into healthcare. I appreciate that. And so let's dig in a little bit to kind of your Davidson experience. And so looking back at your time on campus, what specific experiences, can be a professor, a lab that was particularly challenging, a liberal arts seminar, something that may have unexpectedly prepared you for the complexities of healthcare. Anybody have any thoughts on something that might have prepared them for healthcare?
I guess go first. I took a individual study course with Lance Stell. I don't know if any of you guys took classes with him, but where we talked about the professional role of the physician. And we spent the entire semester. I found it great, and so Davidson, that I was able to just, meet with him once a week. We read books about what it meant to be a doctor, basically, stories and other medical ethics texts, and came away with like an appreciation of what that is and what our role is within the greater context of health systems, as well as the doctor-patient relationship.
I remember taking the an HIV seminar with Dr. Westner, and it just gave me a really good understanding of how much of medicine and health is not really related to the true science of it. It's more what's happening in the patient's life, the socioeconomic, the culture behind um, the certain time in life, the like the time period, the geographic location, the sex, the gender, everything else involved relates to how these patients do and how HIV exists. And so it was just really fascinating. I remember going around Davidson campus and we had to like interview people to get their perspectives on HIV and what they knew. And it was just fascinating to think about Davidson, which we think of this little bubble, but everybody had different ideas of what HIV was and how it affected their life or people they knew or just how they had heard about it in the media or in society. And so it just really reemphasized to me that yes, science is cool, but that's not what medicine, the foundation of medicine is so much more than that. And so that's really applicable to my career. I'm very involved in the county system. Most are immigrants and uninsured patients, and so just understanding that, yeah, okay, they have a certain disease, but what else is playing into that? And so that really made an impact on me.
I'll say for me as a studio art major, I spent a lot of hours in the Visual Arts Center working and reworking pieces. And so it wasn't a science related thing or even a medicine related thing, but just the kind of dovetailed into this cliche of the practice of medicine that you're going to be bad at something when you start, whatever it is, and you just keep doing it and doing it. And sometimes it works out, and other times it's something that you need to take away a learning experience. And I still sort of approach all of my patient interactions with that same sort of viewpoint that some days might not go so well, but it's always a learning process. And there's always stuff out there in medicine that we don't know. And so it's always reading and working on that as well. And then similar to Louisa, I had a study abroad experience that was pretty impactful from my Davidson time as well. And that's really what made me realize kind of end of junior year that I did want to go to medical school. So had the opportunity to spend a semester in Paris and then really shifted gears and went to Madagascar for a semester and learned about natural resource management and looked at how people interact with the natural world and what that means for their health. And so that's what really sort of got me into the idea of thinking about a career in medicine and in infectious diseases specifically.
Like Louisa, I took a few classes with Dr. Stell as well, and they were really impactful and wonderful classes. But my biggest takeaway was probably how to pull an all-nighter, and that served me well my first few years in the ER.
Everything's a learning lesson.
I think Davidson taught us all how to work hard, stay up late. Yep.
I was going to say, I would guess none of you got where you are, and many others on the call for that matter, without some of those aspects. Has looking a little more specifically to your class, How has the bond of the class of 2011 influenced your professional support system as you've navigated your respective careers, or has it?
All day. I mean, I honestly I haven't come across too many Davidson folks kind of after Davidson, just where I've trained and being in Texas. Yes, this is a Davidson community, but not too many of us that I've come across. But whenever I do, it's just a really cool connection. I mean, even I don't know if y'all know Trey Kellogg. He was at UT Health in San Antonio for a while, and we weren't really friends at Davidson, but I ran into him in the hallway in the stairwell and was like, Trey, is that you? And then we kind of formed a friendship, and it's just really neat. You kind of, even though we didn't train together, we didn't really see each other for many years after Davidson. When we did connect, it was just, we kind of understood each other. We understood our paths a little bit better than other people in the medical field might not have understood. So, it's neat to always run across a Davidson friendly face every now and then. And one of my good friends at Davidson now ended up kind of full circle in San Antonio, and she's an OB physician, and Kelly Davis, and I just went and visited her newborn son today. So there's always some Davidson faces around, but it's just neat to still have that connection and kind of understand each other a little bit better in the path that it took to get here.
I agree. No specific connections to 2011, but working in an academic ER, we get a lot of residents from all specialties that rotate through, and you'll see someone wearing a Davidson lanyard or holding a Wildcat coffee cup, and it's always, opens a great conversation.
Similarly, no, not off the top of my head. I think about the 2011 connection, but for example, was at an event for my son's school over the weekend, and a little girl came up to me and said, one of our kids was wearing a Davidson shirt, and she said, "Oh, my parents met at Davidson," and ended up meeting them and connecting with them. So it stands out.
The Davidson connection is far and wide. Switching gears a little bit to kind of more of your clinical and professional specific experience. Since you've each entered the field at different points, but maybe decade, give or take years ago, just what's the most significant shift that you've witnessed over your years in your field, and how we approach wellness versus sickness? Anyone want to jump in?
I can jump in if that's okay, I guess.
Go for it.
I mean, it's kind of a cliche answer, but we can't deny the impact that COVID had. There was definitely a palpable shift in 2020. We went from, especially in the ER, being seen as heroes and trusted professionals the community was rallying behind, to being treated almost like villains who were profiting off positive tests and making people wear masks and social distance, and all of that sort of displaced frustration, I think, opened the door for pseudoscience to creep in and influencers to start spewing nonsense. And we now have a very vocal mistrust of experts, and I definitely see the consequences of that in the ER. I'm sure my colleagues here do too, of patients who doubt the information that you're giving them or might refuse treatments altogether, which is sad because I think we all went into medicine because we want to help people. But at least, for me in the ER, people come to you in crisis, and that can sometimes be an opportunity for them to be more open to hearing what you have to say than, they might otherwise be willing to hear when they're feeling well. So it's kind of an opportunity to treat misinformation with, evidence-based education. You kind of can combat their fear with reason and logic and advocate for their health. So
I echo that too. It has been a strange shift when we came into medicine with this idea of being this respected, knowledgeable professional, and then now I feel like there really is less respect for me, for my colleagues. There's a lot of mistrust. I feel like I spend a lot of time trying to defend what I know, what I've spent years learning, and being told by somebody, well, this is what Google says, this is what whatever AI engine I'm using says. So it can be hard and frustrating and very time consuming. Um, but I think it also, in a way, has kind of brought things full circle to what kind of early physicians, it was all about touching the patient, that just that human connection, I think is becoming even more and more important, rather than the science is important. Yes, we need that. We need that evidence-based information. But just having that human connection, I think, is becoming ever more important. So it'll be interesting to kind of see how what who is attracted to medicine these days, and what that brings.
Yeah. As Meredith said, I think for all of us, just based on when we were training and starting our careers, the COVID pandemic was a huge part of what formed us as healthcare workers. And definitely lots of things came out of that. But I see one potential sort of positive for people in healthcare is that there became a little bit more awareness that presenteeism, so going to work sick, is not necessarily just a show of your personal strength, that it is harmful for the people that you're working with if you're going to work sick. So maybe that's one sort of shift that I've seen over the last couple of years. Healthcare workers are starting to recognize a little bit better that they need to be healthy in order to help care for other people.
Um, Not related to COVID at all, but one thing that I've seen in healthcare, and this has been happening way before we entered medicine, is just, you know, it's amazing that we're able to cure so many diseases and to like extend life for an extremely long time. And it's wonderful. And it's also really hard because there are certain aspects of aging that continue despite that. And so I deal a lot on a day-to-day basis, and I have regular conversations with people of, what's quality versus quantity, and how can we get you to be functional rather than just simply living. And I think that, while we're curing a lot of diseases, and that's awesome and that's great, and we should really recognize that, we also have to understand, like, what are we driving toward? And um, a functional life is something that we should all strive for and hope for in our later years.
Yeah, no, that's so true. I mean, I think, um, there is so much emphasis on being able to have a pill that fixes everything, and rather than the focus on, I mean, there is a lot of focus on lifestyle and that sort of thing, but I feel like it's just not correct. It's focusing on the wrong things, where we need to focus on that quality of life, and how we're filling our days. We don't need to add more things. Sometimes just taking away those supplements, taking away all this other stuff, and just focusing on what we have in our life, what we have on a day-to-day basis. And I mean, I am in GI. We have a lot of people coming in all the time with abdominal pain and reflux and this kind of stuff, and they want a pill that fixes everything, when I have to go back to the basics. It's what you're putting into your body. This is what's causing your symptoms. And it's so hard for people to understand that, but it's just, we don't have a magic pill. We don't have a magic pill to stop aging. There's still going to things that are going to happen. We need to focus on that kind of day-to-day quality of life, and just going kind of back to the basics.
So much sense. So building from that, you each, as we've established, you each represent different facets of the industry, from patient care and policy and research. Where do you see the most friction in the current healthcare system, and where do you see the most hope for reform?
I think there are a lot of issues with the healthcare system right now.
Yes.
Unfortunately. I mean, I think we can all probably speak to a different our own areas of where there are problems. I mean, as a geriatrician, I obviously, want physicians to be able to spend more time with our patients. I think in a broader sense, geriatrics being a part of primary care, really, I think we are at a difficult period of time where it's really hard to have a primary care physician. It's really hard for people to have a good primary care physician that can actually spend time with you. And part of that has to do with insurance and time and health systems, and um, it's it's really unfortunate. And my hope in my hopefully during my career, but who knows, is that insurance will recognize that a little bit more and maybe be able um, to come up with a different model, or we can all come up with a different model um, so that we can actually get the people that need to talk to each other, and the primary care physician, be that quarterback the way they were meant to be.
Mhm.
Yeah, there's such a shortage of primary care providers. And then, especially in pediatrics, kind of from my angle of things, there's a big shortage in a lot of pediatric subspecialists as well. So, as an infectious disease doctor, there aren't very many of us around in the pediatric world. Many of my patients drive 3 hours plus to come see me. And there are lots of other pediatric subspecialties where it's similar stories, whether you're in Indiana, like I am, or really anywhere across the country. There's a lot of need to have more people in healthcare to fill these gaps.
Yeah, I mean, I think the number of problems is endless, unfortunately, and on a day-to-day basis, I'm facing the difficulty with access to care. A lot of immigrant population, uninsured populations, patients that are only can speak Spanish and just have difficulty communicating and figuring out what they need and how to even start process of getting that care. Um, from kind of a different perspective too, is especially in our department right now, there is a huge push, even in academics. You can see it maybe more in the private practice side, but now even in academics, there's a push for productivity. And so we are, it's more about how many more procedures can you do a day? How many more patients can you see in clinic? And we just don't have the time that we need to really feel comfortable like we're providing the best care we can for patients. And then also there's a side to education. We part reason why I'm in academics, I could get a lot more money in private practice, but I want to be an academic because I want to be an educator and I want to teach the next generation of GI physicians. And when I'm forced to do 20 procedures a day, I don't have that time to allow trainees to learn and to educate them properly. So um, it's a big struggle, and I hope that we can find a balance between. I know there's finances involved. We need that productivity, but also being able to not only provide patient care, but also the education for trainees.
I mean, politically speaking, there's just so much friction around, insurance coverage and universal health care and all of that. And so the result is we see so many patients wind up in the ER for primary care or for dialysis or just for all of these unmet needs because they don't have coverage. So the ER truly is the safety net of the healthcare system. We are doing more than ever before. The specialists are coming to us, and there's a lot of really innovative ideas coming out of that. But it's definitely a challenge because it's less so for emergencies, although you still have to care for those too. But you're weeding through a lot of system failures and doing a lot of preventative medicine that really should be happening other places.
I have so many questions and stories from my own experience that I just want to ask each of you about, but we're not going to do that here right now. So much of what you're saying makes sense to me as a patient, as women in high level medical roles, how are you working to change the landscape for the next generation of female health professionals?
Oh, there's so much.
Bring it on, bring it on.
No, I mean, I think that Well, I guess I should say, like for myself at least, as a mom and a physician, that is can sometimes be really hard, wearing those two hats. And at least, when I was working with residents before I moved to private practice, and now, within our practice with three female physicians, we all, strive to have the flexibility that you need in your day to be able to do all of the things you need to do, and also be a good physician. I'm really also just speaking in terms of like how the future landscape will look. I think that there are a lot of great things about AI for physicians that allow us to be able to do our job and also not be bogged down by notes at night and the realities of our job are that we have to document a lot, and I think some of that will be taken away, or at least it is for me.
Definitely. I think one of my what I kind of put on myself for a lot of my fellows, especially the female fellows, is just be a we have a lot of great faculty that are great research mentors or uh, advanced endoscopy mentors, blah blah blah. I'm like the life mentor, and I think it's so important for trainees to understand that being a physician can be a life calling. It can be just your profession. It can be your way to make money. But regardless, it's not everything in your life. There's life beyond, and so we have to find a way to kind of do it all, but in a balanced, well, as balanced as you can get, but in a healthy way. And so I'm very real with trainees, and I'm like, I'm not gonna I'm gonna leave at 5. If I can't get my notes done, then they'll have to wait till tomorrow, or because I have to go home, I gotta be at my son's soccer game, I gotta go cook dinner, I gotta do those things, and that's the reality of it. I'm not necessarily going to sacrifice patient care, but I also know that I have to be present for my family. So just kind of being real, I think, with women, and also letting them know too that I've chosen and I'm happy with my choice, that I'm not going to be the chief of a department. I'm not going to be the had the highest title. I'm not going to climb the academic ladder. I'm very happy where I am, and that's the choice that I've made, and I'm okay with that. Because I can have my life outside of work as well.
I think there's a lot of giving ourselves grace and modeling that for the other people that we're interacting with, whether it's trainees or just other people in medicine. And I don't feel like I've been out of training for all that long, but I already see the current trainees approaching wellness and time outside of residency and training in a much different, healthier way than I did, which is great.
I think for me, and no offense to my colleagues here, but for me, it's about making sure women know there's more careers in healthcare than just being a doctor. I think especially as a high achieving woman, like it's so easy to think that, you have to be pushed down the med school route to be successful. And I would want women who are interested in healthcare to know that it doesn't have to be med school or bust, or if you don't get into med school, it doesn't mean you're a failure. You can have a really fulfilling career in medicine and a balanced life, and all sorts of other allied professional careers. You just have to kind of take that opportunity to understand what's available and what's out there.
For sure. I tell a lot of young people in college and that sort of thing, don't go into medicine or don't become a physician. There's so many other opportunities to be in healthcare, and to do what your passion is without having to be in medicine, because it's tough and there's a lot of things that are messed up in the system. And so you really, I mean, to dedicate that much time, that much effort, to be where I am today, like, looking back, is that something that if you didn't have that drive or feel that tug, is it really worth it? So I do think, I mean, having, nurse practitioners, the APP pathways, being in health policy or in public health. I mean, there's so many different avenues where you can have just the same, if not more of an impact. And so I think that's really important for women, everyone to understand.
Amazing. And just going sideways for a quick second, just a reminder, if you have questions for our panelists, do feel free to put them in the chat. I'm going to post a reminder there too, but just we've got a few more questions, but then we're going to move into our Q&A portion. So do feel free to post some questions for um, these very amazing healthcare professionals to answer while you've got them. So we often talk about patient wellness, but healthcare is a demanding field. How do you each personally define and maintain wellness to avoid burnout while operating at such high levels? And maybe this ties in a little to what you were each just talking about.
Well, I know something that I just kind of went through was I did get burnt out. I was kind of shocked because just, so early in an academic faculty position, I didn't think that I would be burnt out, and was kind of ashamed. And so I knew I had to make a change, whether that be get out of academics, just stop working for a while, or speak up and try to change my schedule. And so which is hard, Davidson and just life has taught us to work hard and achieve and be successful. And I had to kind of, like Katie said, I had to give myself some grace and know, like, I have reached that for myself. I have been successful. I have achieved what I want to at this point in my life. And that doesn't mean that I have to have the highest title, the highest rank. I can make changes that I need to in order for my life to be more accessible and joyful. And so I went to my chief just a little while ago and went more part-time, which and I work 3 days a week now, and it has changed my life. I am so much happier. I love going to work. I am fully present at work, can give everything to my trainees, to my patients, and then I can have my Mondays and Fridays to go to the grocery store and pack my kids' lunch and like not be stressed out about that. So it's been a huge change for me, and kind of took a little kick in the butt to be like, okay, it's okay to make these changes. I don't have to be the successful professional 5 day a week, working hard, doing everything. I can step back, be part-time. Everybody says I can go full-time again. I'm like, I don't know if I'll ever do that. But it's really been wonderful and great for me. And so I can also enjoy the other things that give me wellness outside of work. And so
I similarly went through a situation, I guess it was, within, I guess, last year, where I was also feeling burnt out in academics. And I ultimately made a change to go into private practice. Mine stemmed a little bit more from, always there's the tug of family obligations, taking care of your kids, all of that. Also, lack of time with my patients, which in geriatrics is just necessary to perform the way you want to perform. So I had a little bit of a moral injury in that I felt like I wasn't doing what I wanted to do, or my job, because I didn't have the time to do it. And so I went to a private practice where I'm able to spend more time with my patients. And I'm also like on a slightly more reduced schedule so that I do have the flexibility. I thought about everything from, how much time do I get to spend with my patients to like, well, how long is my commute going to be? And how quickly can I, leave the office, pick up my kid and get home? Does that take an hour or less? Because it needs to. So it's the little things as well as the big things that kind of add up. Yeah.
I'll say for me, my personal definition of wellness is constantly changing, which is probably a sign that I haven't really figured it out yet. But at the very least, I've learned that, my work schedule can be pretty demanding. I may be on call for a week straight and have to, answer the phone at any time for that week. And so when I'm not on call, my nights and weekends are mine protected. I'm not doing work. I'm not doing anything patient related as best I can.
I try to take a lot of vacation. The beauty of emergency medicine is that burnout is it's very prevalent, but it's also recognized. And so I think it's the work hard, play hard mentality is really we attract that type of mentality, which I kind of developed at Davidson a little bit. So, our shifts are grueling. They're 12 plus hour days sometimes, but there might only be 3 of them a week. And then, like Katie said, when you're off, you truly are off. And I try to make the most of that time with family or travel or just whatever I need that day.
I think Davidson taught us very well to be well-rounded and to be able to balance things very well from work, but then also be able to find ways to enjoy ourselves. Even when we have something big the next day, we still can find ways to enjoy life and figure out what wellness means for us.
I mean, lessons in and out of the classroom, right? And that's part of that liberal arts education, hopefully, right? So if you could go back to your 2011 graduation day, or close to it, what piece of wisdom would you give your younger self about the reality of a career in medicine?
I kind of said it before, but for me, it's just that, there is more to healthcare than just being a physician. So just explore what's out there. Even beyond the careers represented here, there's, health policy, there's medical malpractice lawyers, there's physical therapists. I mean, there's just so much out there. So don't be discouraged if you don't know exactly what you want to do on your graduation day. You have your whole life to kind of figure it out. So have those conversations and think about what really will make you happy, because I know from working alongside my colleagues, medical school is not for the faint of heart and it's not for everybody. So before you jump in, make sure you're committed to what you're doing.
Mm-hmm.
When I was an intern,
oh, sorry.
Oh, sorry, go ahead.
No, go, Louisa, go.
When I was an intern, one of my chief residents gave me a really good piece of advice, which I wish I had known when I was graduating Davidson earlier on, which is don't judge your insides by someone else's outsides. Which, I think is a great reminder of both like that we kind of all go throughout medicine with this imposter syndrome of like thinking that we have to be something that we're not. And really, whenever you're just your authentic self and open and real about what you can and can't do and what you're willing to try, is ultimately what will get you where you want to be.
I love that. That is very similar to what I was going to say, Louisa. But I love that I might have to use that. But one thing I think, if there are any current students at Davidson or just from looking back at my experience at Davidson before going to healthcare, I think just taking advantage of that liberal arts education and getting a well-rounded education. I mean, learning about history, learning about psychology, learning about religion, taking an art history class, just broadening your horizons, I think is so essential to become a better physician or healthcare provider, in regardless of what means that might be. Just better understanding the world, the people that are in it. We have to understand that in order to understand medicine. And so I think, unfortunately, there are classes that you have to take in order to get into med school and that sort of thing. And yes, I was a biology major, I admit it, but I think, the classes that I remember the most outside of the HIV class are going to be the Hinduism class I took, Impressionism class. So I think that you don't necessarily have to get sucked into this science only pathway, but really trying to keep your option, not your necessarily options if you want to go into medicine, but your mind, your just your intellect open to all sorts of different areas, all sorts of different subjects.
I'll echo that, Sarah. There's so much more to medicine than just memorizing the textbook and being able to regurgitate that. There's all this, critical thinking and noticing details and interacting with people and kind of recognizing their lived experiences that comes from a liberal arts education, but comes from just living your life in the world and doing all kinds of fun stuff. And so you explore and see what life brings you, and then kind of figure out what your niche in medicine is, because there are so many different options. There's a place for everybody.
Well, you all are beautiful examples of this liberal arts education. We have some questions coming into the chat. And so again, for folks on the call, feel free to keep sending them into the chat. I'm going to get through some of them. And for our panelists, for you to know, there's some questions and then some other lovely words. I can share all this with you afterwards as well, so you can read it. So I have a question that says, how were you able to complete your medical school prerequisites if you were a humanities major?
Well, there's that wonderful pre-med program or at least that I went through, and was able to just sort of map out what I wanted to do for my major and what I needed for medical school. I did take a year between medical school and Davidson, and that was really more to take the MCAT. I had finished all my courses, and during that year, I did research in ethics, as I mentioned earlier.
I did have prerequisites for my program, for my master's program at Emory. I had to do some summer classes at other institutions. So I spent some time taking anatomy and physiology, organic chemistry at a university near where my parents were living at the time.
I also took some summer classes, partly as a studio art major, couldn't quite fit everything in. And then I spent a whole year abroad, which was a wonderful life experience, but not the greatest for fitting in prereqs.
Another question, did any of you use a gap year? We kind of talked about this, but did any of you use a gap year to complete medical school prerequisites, or were you able to complete all classes needed at Davidson? We kind of addressed that, but I don't know if anyone else wants to add anything.
I mean, I think just in regards to the gap year, I think there's been kind of a shift in how we approach the gap year and how it's accepted. I feel, and you might think otherwise, but when we graduated from Davidson, it was pretty routine to just go straight from college into medicine. There are a few people that took gap years. Louisa, you took a gap year, and mainly people doing things kind of in research or in medicine. And now, I mean, talking to med students, it's the norm to take gap years, to have another career before medicine, to go travel, to do other things. And it's looked in the medical school application cycle. I mean, it's looked at highly upon because you've had these other experiences, done these other things. So yes, you might have to take a gap year to take some medical school prerequisite classes, that sort of thing. But also, I think it is also good to have other experiences during those gap years. Take advantage of that time, and learn something new, learn a new skill, have another job for a little while. I think it is thought of as encouraged now.
Another question came in. We kind of talked about AI a little bit, but I think this is so related but different. In an era of increasing automation and AI in medicine, how do you protect the wisdom and human connection that is central to patient care?
Maybe I'm a proponent of AI right now. We'll see once, Claude becomes me in 2 years. But I think that actually, in my opinion, AI actually allows us to enhance that human connection. Mainly because, it's one of the things in medicine, which I mentioned earlier, is just the fact that, for a good decade, doctors have been behind screens to write their notes and to take notes while they're seeing patients to get, all the things done that they need to do. And AI actually allows us to look at the patient instead of looking at our screen. So just like on the micro level, it helps with note writing. And then on top of that, we have AI tools that help us with looking questions up. If you ask the right question in the AI tool that's specific for medicine, you're going to get a decent answer that you may need to, fact check, but that also allows us to treat patients better. I'll be the first to say in primary care, we don't know everything. And though we went to medical school and have the building blocks, research is coming out all the time. And it allows us to stay up to date and to really use the tools out there to help our patients. So right now, I'm all about AI.
I love that. I feel like I'm like the most resistant to AI. I definitely see the benefits of it. I'm kind of old school, and the way I process when I'm with a patient is I like to write out my thoughts. And maybe Davidson did that to me when we like our biology tests were like essay tests, but I really like that process, and so having AI dictate everything for me is a little bit hard for me to do. But the fact that it does allow you to get off the screen, have more of that patient face to face, looking at the patient interaction is really important. One thing that AI makes me nervous of is as an educator, um, how much our trainees are relying on AI to formulate their plans, and it makes me really nervous. And so AI is getting to a point where it is very good at coming up with assessment and plans for these patients. And so I have to be really hard on my fellows to make sure that they're the ones formulating the plans and also planning for the future. What if this doesn't work? What are we going to do next? Which AI isn't great at yet. So we'll see what happens. It's going to be interesting over the next, I mean, the way it's exploded even just this past year. We'll see what happens just over the next 6 months. But us in healthcare, we're up for challenges. Things have changed. We went through the COVID pandemic during training, and so we're up for anything.
Yeah, I'm excited about it. I think, like Louisa said, I think it's going to allow us in the ER to spend more time with patients, especially the ambient AI. That's just, you're not so focused on missing information. You can just really interact with the patient and know that it's going to be captured. And I know AI can't replace, resuscitation skills. It can't reset a fracture. So there's always going to be, I think, that human touch to healthcare.
Mm-hmm.
I think there are a lot of areas of medicine too where we don't necessarily know the right answer yet because we just haven't done that research. And there's questions where we don't have enough patients to pull together all the data. And maybe AI can look at those gaps and kind of fill them in a little bit.
In every field, pros and cons to AI, right?
Yep.
Pros and cons, and who knows where it's going to take us, right? We have a question, I think, from a family member. Do you feel like medicine is changing into more of a team approach to care as opposed to one doctor taking care of one patient?
EM is absolutely a team sport. Um, so I think it always has been and it always will be.
I think it's definitely becoming, I mean, I think medicine, honestly, the best medicine is always a team sport. But I think also now people are specializing so much. Everybody has their own little niche, that we have to work together as a team if we want to take care of these patients. And they have each of their little specialists, which can make care harder to obtain and more challenging, more communication needed. But we have to work together with our colleagues who are expertly trained in different areas, and which makes it fun. I'm always been a team sport player. I love being a part of a team. So that's one reason why I love going to work every day, is because I do get to interact with so many different people.
I think there are moments when it's good to be part of a team in medicine, and there's some moments where I think it really requires just one person. And I would say like the specific moments would be, in my past work in at GW on faculty, I did a lot of hospice work. And that is a situation where I think, it's helpful to talk with a team for, creating plans, but sometimes it's really an intimate experience where, um, by bringing a team in that environment, it really dilutes the importance of one, the doctor-patient relationship, and two, the understanding of what is happening. It's kind of like a loss of touch of, the reality of the situation in front of you. And so what I think there are times for both. And I think the way medicine has used teams is awesome and great in certain situations, and there are times when it really requires just one.
Well, I see we're at time. We have a couple more questions, but I want to honor everyone's time this evening. And if and we're going to send a follow-up email that'll have contact information for these panelists if anyone wants to ask questions beyond tonight. But I want to thank our panelists. I want to thank Katie, Sarah, Meredith, and Louisa for taking time to speak with all of us tonight and leading us in this truly informative class. So grateful for everything you've shared, and again, we're seeing lots of appreciation in the chat here as well. A follow-up email is going to be sent tomorrow with contact information again for our speakers, for a brief survey, and then some other helpful information. Note that tonight's event was recorded and will be available on our back to school class website, if not by the end of the week, by the beginning of next week. And so certainly feel free to check back and take a listen to any parts of tonight's call that you thought were particularly helpful, and or feel free to share the link with others as well. We certainly want to share the just the wealth of knowledge that we had the benefit of hearing tonight with anyone else that might be interested. And just thanks to everyone who joined us tonight. We're so grateful for you taking this hour to join in and listen to tonight's call. And we hope everyone enjoys the rest of your night. So thank you.